Good afternoon, everyone. We would like to welcome you to the 2020 HitLab Global Innovators Summit. I would like to thank everyone for joining us today. We are so pleased to have you at day 2 of the Global Innovators Summit. We would like to start on by thanking our sponsors and knowledge partners, including CTA, Ellipsis Health, AdhereTech, Persistent Systems, IMC, Medidata, Modern Craft by MAS, Moses and Singer. We would like to also thank our knowledge partners, Harvard, FXB, Bayer, Livongo, Global Health Innovation, the George Institute, Cornell Tech. Lastly, I would like to thank our impact partners, firstly BioVoice, who have been associated with us for the past 5 years. It is one of India's leading digital news media platform focused on the Indian bioscience sector. Also, we have partnered with BioSpectrum, Smart CEO, Medgate Today, Pharma BioWorld, Pharma Tutor, Modern MediHealth, Tech Plus Media, Health Biz Insight, and Pharma Machines and Technology. Thank you all for your support on bringing this together and contributing to HitLab's mission to improve healthcare access and delivery across the globe. Today at the summit, we will get to hear insights from veterans of the industry on health innovations, roles of different stakeholders, and how breakthrough technologies are reshaping the healthcare system. We will begin with the individual insightful talks and then move on to engaging panel discussions, focusing on global trends in digital health innovations along with their contextual fit to India's healthcare ecosystem. Please feel free to put your questions for speakers in the chat box on the live session. So without further delay, let's begin our first session on health innovation exchange, leveraging health innovations and taking them across borders for scale and impact by Mr. Pradeep Kakkattil from UNAIDS. I would like to give a brief introduction of Mr. Kakkattil. Pradeep brings over 3 decades of global health and development experience. Over the last 2 decades, he has played leadership roles globally with the UN, starting from leading the political negotiations for the UN General Assembly Declaration on AIDS to establishing the largest technical support mechanism that helped the UN support countries to raise over US 15 billion in funding for HIV. In 2018, he co-founded the Health Innovation Exchange platform that connects innovators with countries and investors for fast-tracking progress to SDGs. Mr. Kakkattil, we are delighted to have you today and we request you to proceed. Thank you. Over to you.
Irfa, thank you very much and good afternoon, everyone. Thank you and congrats. I think just looking at the partners that you described, it's fascinating to see the number of people that you've been able to bring together to focus on what I believe is one of the biggest fundamental defining challenges, and I would say the defining moment when it comes to global health. So first of all, congratulations on that, and it's a delight to be here. I'm going to spend about 12 to 15 minutes talking about the Health Innovation Exchange and what we do, and how that fits into the overall agenda that you spoke about, Irfa, about providing access to healthcare, equitable healthcare globally. How can we do that? Let me start with a very small story, and then maybe that'll help to illustrate what we are trying to do. I come from India. I lived in Chennai. That's where I grew up. And in the early days, I was a filmmaker. I used to make films for Doordarshan and advertising films. And what I discovered one day was while I was doing a shoot for a HIV film, I put one of my friends in front of the camera, and then we started the film, and then we tested just to show how a person is tested for HIV. A month later, the clinic called me and said, look, the person you had filmed, the person who was your friend, he's tested positive. You need to bring him in. And that's a sad story because his wife was pregnant. She tested positive. A child tested positive. So for me, that's where I come from. I worked on health over the last 30 years, mostly in the developing world. And a couple of years ago, what happened was that I was sitting with ministers of health from several countries, and we were discussing, why is it that despite having all the technologies that we have access to today, digital health, you look at diagnostics, you look at medical education, how that is being transformed, why is it despite all this that countries are not able to adopt these technologies and scale up their use. I mean, even the last session I was listening to is about looking at virtual care, looking at telemedicine. Some of these things are not being adopted on scale in several developing countries. And what surprisingly came from every minister that we spoke to, and these were ministers predominantly from Asia and Africa, what came through was, number one, they said, look, there are so many technologies out there. There are so many different tools that all of you bright inventors who are listening, all of you are developing, but nobody really comes to speak to us to find out what our challenges are. What is the problem that we are facing, and how can you help us to address those challenges? So far too often, nobody comes to us. What they were saying is that the only people who come to us are people who are either our friends or people who want to sell something to us. And we do not know who to trust. I mean, is it when somebody is trying to sell something to us, can we trust it? Is it the right thing? Is it going to solve my problem, or is it going to really just sell something to me and then go on? So that's one thing which struck me as very strange, because here are solutions that can really solve problems, but maybe these solutions are not owned by people who have the problems that we are trying to solve. And the distrust that exists between the people who want solutions and the people who really are developing solutions. And fascinating, because we had a similar conversation with several innovators from India, but also from other parts of the world. And what was fascinating is that, including in the global north, people who are building fantastic solutions, both in the global south as well as the north, most of them want to work with ministers of health to identify their problems and to find solutions for them, but they don't talk to each other. So there's a huge disconnect. One is because of trust, and the other thing is that they don't have the opportunity to sit down and talk to each other. So predominantly driven by that lack of trust. So that for us was a huge challenge. And being the UN, we felt that we had the trust on both sides. We had the trust of the ministers of health across several countries because we have been working with them over years, and we are neutral. We don't have anything to sell, and I would make a terrible salesman. So they trust us for that. And number two, they also know that we understand the problems from their perspective. On the other side, we have innovators who have the solutions and who want to partner with these countries. And we felt that we had to play that bridging role to bring the ministers of health with the innovators and try and have those conversations so that we can solve many of these problems. That is how the Health Innovation Exchange was set up. It's a platform that works with ministries of health to identify their challenges, and then we work with innovators to find solutions. So that sounded like a good idea. We started with that, and then very quickly we learned that, okay, one was this identifying challenges and finding solutions, but the bigger problem was, even when you have the problem properly defined, you have the right solutions or sets of solutions. And that's the other lesson that we learned, is that for most of the challenges, it's not one solution which is going to solve it. There's no silver bullet, right? So you need to bring in multiple solutions to come together, to stitch together that partnership. And fascinating, when you bring innovators together to work on a common set of problems, you find magic happen, because when each one of us holds, as innovators, we hold parts of the puzzle, we have pieces, and when you bring them together, you can really have impact. So we started doing a lot of that. But what we realized is that even when you have a solution, then far too often, the ministries of health do not have a procurement system that's easy to procure innovations, because most of the procurement system that we have today are antiquated. They are not ready for the society that we live in today, with all the technological changes that have happened. We are not geared up for that, because we are still looking at comparing whether you buy the classic traditional goods that we are used to buying. So we needed to see how we can work with, one, the procurement system to make sure that there is space for innovators to be brought in, for the innovations to be adopted and mainstreamed into the healthcare system. The second part was that even when innovators had solutions that were market ready, scaling has not happened. There is what I would call a pilotitis, which is a major problem. You have pilot after pilot after pilot in the developing world, and it never gets taken to scale. So we realize that the traditional model of financing for health, if you look at several countries, the low-income countries, low and middle-income countries, there are several ODA, the Overseas Development Assistance donors, who are working in strengthening health systems. But most of them basically do not have an appetite for taking risks, which means they do not adopt or embrace innovations which can make a difference. So we started saying that, okay, if that is not going to work, there's no point coming up with problems and then finding solutions. You make those wonderful marriage, but if that marriage is not going to produce results, then it's not going to move forward. So what we started doing was to try and see whether we can work on rethinking how investments can be made in this space. So we started working much more with social impact investors, but also the larger, I would call it private equity investors who had interest in health, and started working with them to address some of the risk perceptions that they have, which are often far overstretched in terms of their perceptions of way above what the reality is. So we started bringing together some of these investors, and we have started stitching together. One, you have the problem, you have the solution, and then you bring in the resources which are needed to take solutions to scale. Over the last 2.5 years, when we have been operational, we have managed to mobilize about $200 million in investments for innovations, for taking some of these innovations to scale up. Now, why do I believe that technology and innovation is going to be absolutely critical for the world that we live in and the world that is coming? And COVID for me is a huge eye-opener for the world. I mean, it's been, in less than a year, we have seen how it has completely devastated the world. And we have seen so many of our development gains that have been made over the years, over the last 2 decades at least, they have all been reversed. So we are talking about what, at least 400 to 500 million people going back into extreme poverty. That's taken us a long time. So, and again, with climate change, what I believe is that there are going to be more and more pandemics coming more and more frequently. So that's going to be our challenge. So we need to prepare the world. Now, what I'm seeing is that if I take the contrast between the developed world and the developing world, there's a huge difference between these two in terms of health and healthcare access. And that is going to come at a huge price if we do not address it now. And I'll take an example. Last year I turned 50. Again, probably one of the things that as a UN bureaucrat, what you do is you sit in meetings, right? That's what UN bureaucrats do. So I was in New York. I was at a General Assembly session in June, just before turning 50. And I was on this panel, and I was sitting with one of the ministers, the minister from Sierra Leone, health minister, amazing person. So I was sitting with him and we were chatting, and then I said, look, I'm going to turn 50 and I'm thinking about what I need to do and what life holds for me. And he said, if you're in my country, you don't have to worry very much because you have less than a year and a half to live, because Sierra Leone's life expectancy is around 51, 52. So he said, you don't have much to worry. And that was a big shock for me, because if you're in Sierra Leone, your average life expectancy is 51, 52. If you're in India, where I come from, it's 68, 69. And if you're in Geneva, Switzerland, your life expectancy is 86. So there's a 35-year difference between Sierra Leone and Switzerland. Now, not all of it is because of healthcare access, but there is certainly a huge part of it which is because of access to healthcare. So how can we transform that? And the more we have these divergence, huge disparity, the less likely we are going to be in terms of our social and economic development into the future. So that's where we started looking at what is needed fundamentally, structurally, for us to be able to scale innovations. First of all, again, sitting down with several of the health actors in countries, what we realized is that it's wonderful to have these tools, each of them by itself absolutely brilliant, very, very creative, very, very useful. But then, and let me take an example. We work with one of the innovators who's the pioneer when it comes to telesurgeries. Nadine has done some amazing work. Proximi, you can look it up. Fantastic tool, absolutely brilliant. You can do a lot of things, and we see huge problems in terms of access to surgeries, and certainly in Asia and Africa. Now, what we realized is that there are two challenges. Number one, and this was with the Malawi minister, that he basically jokingly said, look, I have all the tools that I need, but most of my clinics, most of my hospitals have 3 to 4 hours of electricity. So if I do not fix that, all your tools are going to be just sitting idle. And interestingly, if you go to several countries, including, I won't name the countries, but almost every country, every hospital you go to, you will see a room which is dedicated to medical equipment, which has gone, which is because of lack of electricity, not only because of lack of electricity, but because of the huge fluctuations in electricity. They've all, 70% of medical devices break down within the first 2 years in most countries. So they have this mortuary of medical devices, which is in every hospital, I can guarantee that. So one, we felt that, and we looked at this, most of the countries, between 1/3 and 2/3 of the clinic and hospitals do not have access to quality energy. So we then decided that we need to fix that, we need to work on that, because without that, a lot of the issues that we are talking about providing these wonderful tools, they won't have any value, they won't have any, the usability is not there. And unless we fix that, we'll not be able to scale access to healthcare. So what we have been doing is working with the International Solar Alliance, which I must congratulate. India is the presidency of the International Solar Alliance. It's a vision that has been driven by India, and it has over 80 member states who are part of it. We are working with them, and we have recently launched what we call the Solar for Health ISACARES initiative, which is a $150 million investment, 50 million in grants, 100 million in investments to scale up access to quality energy solutions for healthcare. And that is very critical. I mean, if you want to roll out vaccines, you don't have a cold chain, that energy solution is not going to come from any other traditional source. It has to be off-grid solutions in several parts of the world. You want to put in digital health record. I mean, I won't go into the details, but if you want to look at use of AI, you look at any solution that you have, energy is absolutely critical. The second piece which we are working, we haven't made much progress on this, but that's something which as the UN we are very, very keen on, is to look at how can we ensure that you have high quality broadband-like connectivity in even the remotest areas. We are very excited that many of the low orbit satellites which are being launched will ensure that we have that kind of connectivity across even the remotest parts of the world. So we are very hopeful that we will be able to draw on three things. One is these kind of connectivity. Two is energy solutions that will ensure that the health facilities have the ability to draw on new technologies. And then we are working with innovators. And this, I'll stop in a minute. I'm not sure how much time I have, but very quickly. What we find is two additional challenges that we need to address. One, most of you who are innovators, I'm sure you've faced this. We do not have a common health technology assessment facility, which looks at, okay, this technology is mature, it's been tested, it's ready for scale. it's ready for prime time. And this one, yes, it is promising, but it needs more work to do. There isn't anybody who's really doing that on a consistent basis, not just in one country, but how do you ensure that when it is done in one country, it's accepted by other countries? So we are putting together what we call a common health technology assessment platform, which will bring several countries. At this point, we are working with 12 countries to build that. And India has been very active in that space. We want to make sure that once it is adopted in one country, for example, if it is an innovation that's developed in India, it has been tested in India, then it is ready for prime time in other similar settings in other countries, not just in Asia, but also in Africa and Latin America. So that's one thing which we are working on. We should have something ready by mid-21. The second part is that we are seeing more and more that with COVID also, we are seeing that there is increased investments and there is an increased attention to healthcare. We need to make sure that this does two things. One is it ensures that there is investment in the fundamental infrastructure that is needed, but also simultaneously, we need to expand the resources that are available for innovators to continue to do what you do best, which is to find new solutions and then to connect those solutions to have impact. So we have set up a investor coalition which brings together several investors. It is by invitation only. We are being very picky, choosy about who those investors are. And that is just being launched. It'll be on the margins of the World Bank spring meeting. We'll be launching that. It's limited to 22 investors that we are bringing together who are committed to health, and we are looking at certain values that will ensure that we are all aligned and we are investing in the right space. So what the Health Innovation Exchange does is really work at the policy level, work in building these trust and conversations between ministers of health and innovators, look at some of the fundamental structural issues and addressing it, bringing new resources to invest behind some of these solutions, and to continue to build those ecosystem, I would say the stock policies that are needed for innovations to thrive. So it's really a pleasure. We are very, very happy to work closely with all innovators. And if you have any questions, if you have any suggestions, feel free to reach out to me. You have my contacts. Back to you, Irfa.
Thank you so much for the wonderful insights. And we have a couple of questions. Number one is, how can India boost social impact investments? So essentially, how can countries like India boost social impact investments, and how successful and impactful is the healthcare delivery in such cases?
Thank you very much, Irfa. I think I'm a bit of a naysayer when it comes to social impact investment. I think I do believe that we need grant money and philanthropic capital, certainly. A lot of the social impact investment, what it does is that it basically makes everybody feel that we have taken care of the problems. So, and it's never been on scale. It's never really looked at the kind of scale for me. And I'll give you a quick statistic, and this is not so much about India, but globally. The last year, the World Overseas Development Assistance, which is the donors investing in various sectors for development, was about $150 billion. If you look at the private equity capital, that is probably in 20 to 30 trillion. For me, it's better to look for investments coming from that 20 to 30 trillion. Even if I can attract 1%, that's much better than 10% of the 150 billion, right? So I do believe what India needs to do is, India has some absolutely brilliant models when it comes to impact investment. We work very closely with Social Alpha, which is a fantastic platform. But I think what we need to do is to really build a business case that can bring your mainstream investors into putting money behind you.
Thank you. And the next question is, how accommodating government has been in implementing these initiatives like the Innovation Exchange platform that you just spoke about?
I think it's been fascinating working with some of the governments. There are several governments that we work with very closely. In India, again, BIRAC has been I think you have one of the best models when it comes to embracing innovations and investing in innovations. So BIRAC, we work very closely with them, with ICMR and others. Outside India, in Africa, what we are excited by is that more and more the ministers of health that we see, they're much younger. They understand technology. They are the people who have grown up on WhatsApp and Zoom, and maybe not Zoom, but Facebook and everything. So they understand the potential of technology. And they have been very much involved in providing the space for innovations. What we also are seeing is that most countries want to, they realize, I mean, I'll give you, I won't name the country, but I was with one of the health ministers, and he was telling me, look, I have these problems. I need you to help me with energy for my health facilities, blah, blah, blah. We spoke for about half an hour, and at the end of it, he puts his hands around my shoulder, and he says, my brother, if you get this for me, in 5 years' time, you'll be calling me Mr. President. So most of these people understand the political benefits and potential returns on doing something using technology. If you can deliver healthcare, it's a classic political winner, right? So that's where we need to look at it from a political perspective, not just from a technology perspective. And we've been very excited by how governments have responded to technology and innovation.